Good morning, everyone. Welcome, William. How was your trip? Good morning. I'll be presenting economically viable mix in Africa. Well, I have two case presentations and then just demonstration of the GAT and next, please. We can skip this. We already know that glaucoma is, and the classification has been talked about. Can we go on, please? The benefits of MIGS.
Hello.
Okay,
Check.
Case one is Mr. NB, a 51-year-old male who's a trader and a Christian, presented with hazy vision of 2 years duration and was on 4 medications, known glaucoma patient for 10 years, and there is no family history of glaucoma, also hypertensive, and wanted a second opinion. On examination, the right eye was light perception with no improvement, and the left was 618 with 6/9 correction. The anterior segment clear and deep. Intraocular pressure 36 in the right and 28 in the left. Gonioscopy open angle, grade 3, and then sclerosis. The visual field is actually advanced with 33, minus 33 MD in the right and minus 14.24 decibel in the left. This shows the cupped optic nerve head. So he had left focal emulsification with GAT, and first day post-op, the vision was HM. The anterior chamber was deep with 10% hyphema. Intraocular pressure was 4, and the pupil was round with posterior PCIOL in the back. The third day post-op, the vision improved to 618 unaided and 6/9 with a pinhole with intraocular pressure of 7. Next, please. This shows the GAT procedure. Is a very short one. Can we just go to the next one? The second patient is 75-year-old with bilateral primary open angle glaucoma and cataracts, had phaco plus trabeculectomy in the left and combined phaco with CAUC in the left. The visual acuity was 6/6 in the right, in both eyes, with intraocular pressure of 14 in the right and 10 millimeters. And the at 6 months, the only thing about this patient is the comfort, that the patient actually had concerning the mix. And this is one of the advantages of mix. preserving the conjunctiva. Okay. So talking about the economics of MIGS, the uptake of MIGS procedure in African continent has actually been slow despite the geographic prevalence of the disease. The cost is something, especially when it comes to the angle-based instruments or procedures, because of the cost. And the average price for the device-based MIGS range from about $1,500 for the cost of iStent, and about $2,000 the cost of Prisaflow and Zengel. GAT and, well, trabeculectomy may cost between $600 to $1,000, depending on the technique. And when we look at the average per capita income and the purchasing power parity in the low resource countries, like the sub-Saharan Africa, mainly we depend on maybe a financing system where governments may be responsible for the spending, and we know that the type of insurance schemes which are actually underdeveloped in most countries, with high, out-of-pocket payments by the patients. So there is also a high dependence on external donors, when it comes to funding in health. The use of 5-Proline with GAT and like 23 cystotome needle and cow plate in goniotomy, or the Taneto ab internal trabeculectomy microhoop, these are, which is actually reusable, could be economically, viable in sub-Saharan Africa. And the cost of these procedures, it's so minimal, maybe a few cents to about $100 when you talk about GAT, like just with 5-Proline, which is widely available. And like there are some patients that had their surgeries yesterday, 3 had goniotomy, and they're doing well, despite the presenting pressures of about 40, 50, and their pressures were better this morning. And 23, this is one of the procedures, 23 gauge straight cystotome goniotomy by La Roche. Can we have the next one? And also another one with Kahoot dual blade in primary open angle glaucoma with good results. So in conclusion, MIGS actually could be affordable in sub-Saharan Africa, and this actually improves the drainage and establishes the natural drainage system for the aqueous. It preserves the conjunctiva for future surgeries and avoids bleb-related complications like blebitis. It also allows drainage into the natural system, and the pressure lowering effect is 30 to 50%. Thank you.